Hello, and welcome to this special presentation on how spinal decompression successfully treats disc conditions when other therapies have failed. If you are suffering from a disc condition, whether it's a herniated disc, a bulging disc, a degenerative disc, a lumbar facet syndrome even, you are in the right place. This will help you make a more well-informed decision about your health moving forward. So quick introduction, my name is Dr. Mike Smith. I am a sports chiropractor and a primary spine practitioner at Tangelo Health. We are an award-winning chiropractic and rehab company with 2 locations in Seattle, both in Green Lake and West Seattle. We've been working with patients with chronic neck and chronic low back pain for over a decade now, and our goal is to help people get out of pain fast and learn strategies to overcome pain long term. So we are now offering spinal decompression therapy to help treat people and patients with chronic back pain that may have been resistant to other forms of treatment. Today, we're going to go over a lot of disc. Quick stats on back pain, quick stats on disc conditions, the types, the symptoms, what causes disc conditions, how to tell if it's a disc condition or if there's something else going on, and then common treatments for disc conditions. But we'll also be spending a lot of time introducing what spinal decompression is and how we do things different at Tangelo. So quick stats, let's look at the nuts and bolts of low back pain. Back pain in general affects over 30 million Americans, so that's a big deal. That's a lot of people that are affected. 8 out of 10 Americans will be affected by back pain at some point in their lives. So if you're here, you're not special, and that's a good thing. But general back pain is much more common in women than men, and 54% of back pain patients report pain coming from working at a desk. So you may have even heard the saying, sitting is the new smoking. But really what we're learning is it's likely not that sitting itself is bad, but an overall lack of movement. So let's not vilify the desk work. It's not going away. I bet you guys are all really good at it. So it serves its purpose, but let's be more encouraging and encourage people to be more active and move more. But I digress. But here's an eye-opening statistic. 9 out of 10 patients never know the primary cause of their back pain. So this is so important because a lot of times you'll go to a chiropractor, a physical therapist, or a medical doctor. You'll never be given a diagnosis. And this just simply makes back pain and therefore finding the correct type of therapy very confusing. And I like to say often, like, pain can be complicated, but solutions should be relatively simple and straightforward. And really, with not enough time in the day and too many options to choose from, it's really essential to have at least a working diagnosis and a solid understanding of what specifically is driving your pain. So finding the appropriate treatment promptly gets you on the right path and really saves you time and resources in the long run. The lumbar disc is the source of about 41% of patients with low back pain. So let's take a look at some of the nuts and bolts on this disc condition. So even with severe types of pain and symptoms that come from discogenic low back pain, only about 1 to 3% of patients, 1 to 10 depending on the study, percent of patients with disc conditions will need or require surgery. And this is good news. So it's crazy how severe symptoms can be, but with the right treatment, patients can get relief relatively quickly. 50% of people 50 years old and over that were examined with an MRI have some degree of disc bulging. This is so important. And this is why it's very important to make sure you look at the patient as a whole. We know people, essentially what's happening is we know people with debilitating low back pain and nothing will show up on an MRI. We have people with MRIs with arthritis, disc bulges, disc herniations, nerve compression, decreased disc spaces, modic changes, so the bone actually changes, and they don't have any pain. So that's one of the reasons why back pain can be often complicated, but also making sure you're treating the patient as a whole. We're not just going off of what the MRI looks like. We're looking at all things. We're looking at how it shows up. We're looking at movement. We're looking at the context of that patient's life. So it's more than just what's showing up in the image. That's really important. So especially if I'm 50 and all of a sudden I get back pain and I go get an MRI, it is likely they're going to find something. So don't be jumping into anything too fast. Make sure you're with a provider you can trust and make sure you're on the right path with the right treatment. A disc can take several months to heal, sometimes faster, sometimes slowly, and rarely is there one magic bullet for treatment, so keep that in mind. 90% of disc bulges occur in the lower back, and we see this a ton at Tangelo. We specialize in treating the spine, but we also see the neck or cervical spine and cervical disc quite often too. A lumbar disc is typical of having pain down the leg, and a cervical disc, you'll have more symptoms in the top of your shoulder or scapula and tingling into your hands and fingers. Pretty interesting, the size of the disc bulge or herniation does not correlate to the severity of symptoms. Again, I've seen huge protrusions with minimal symptoms, and I've seen teeny tiny little bulges with absolutely debilitating pain. So again, that's what makes disc conditions a little bit trickier. Discogenic low back pain can often be more difficult to diagnose, which means it's difficult to treat. And this is why it's so important to get evaluated by a specialist and understand exactly what's going on for your specific context. And especially if your back isn't getting better, sometimes often like time and rest and then just staying active can make a big difference. But if you're not feeling better within weeks or months, not only is this something that can really make an impact on your life, but you may have even some more serious things going on. So it's important to really determine if it's a disc versus a muscle versus a ligament, or even if it's just referred pain. But making sure you know what's going on helps you get a more specific treatment and manage your symptoms much more efficiently. And I see it all the time. Back pain can go sideways real fast just because a patient gets the wrong information at the wrong time. So keep that in mind. So disc-related pain is the primary condition we treat with spinal decompression therapy. A bulging or herniated disc can also cause sciatica, which is what you'll hear lumbar radiculopathy, which is the medical term. The sciatic nerve is the largest nerve in the body. It comes out of the lower back and travels down the leg. So when we have a bulging disc or a herniated disc, and it can cause pressure on that nerve, then we get pain that travels down the path of that nerve from the back and sometimes even below the calf. Compression on the disc or just inflammation around an irritated disc can cause congestion or pinching of the sciatic nerve, which causes those nerve symptoms like numbness and tingling and sometimes even weakness. You can see it circled here. That's a pretty significant disc bulge. Degenerative disc disease. These are for patients typically over 60 years old. Usually patients over 60 years old, there's about 60 to 70% that will have some form of degenerative disc disease. It's very common. The disc essentially loses its hydration because it's made up of over 80% water, which basically the water squishes down and we lose space. If you have had an MRI, you'll also see the term modic changes that are inflammatory pain drivers within the vertebral bone itself. Those can cause back pain. So the disc is just not as tall. It's not as plump. It's not as strong. And in conjunction with other inflammatory factors that are congesting and compressing that area of the low back, sometimes you just run out of space. And sometimes that's when symptoms show up. So there's some degree of degeneration is normal. There's a lot of people who have normal disc height, but normal disc height loss don't have any symptoms, like we said. And that's where we talked about the MRI study on the previous slide. But if you have symptoms or your doctor is talking to you about medication or surgery, if you're hearing words like stenosis or nerve compression or facet irritation, you want to explore all options to manage that. And these are the structures that you can help heal, and then the symptoms will go away. So I mentioned the facet joint. You can see it circled there. When the facet joint itself is the pain driver, you will hear terms like facet syndrome. The facet is the joints that stack in the back of the spinal canal. I bring this up because facet issues can be a secondary problem to a disc issue. Again, if there's a dehydrated or a degenerative disc in the front, that'll put more pressure in the back. If that makes sense. Less disc space in the front puts more stress on the joint in the back. And then the sciatica or the lumbar radiculopathy has a major disc component or irritation to the nerve roots that it causes a sensation of numbness and tingling, sometimes weakness on that nerve, and then you'll feel it down the leg. It's a big indicator that nerve pain is a big indicator of the disc issue, and we see those symptoms all the time. You may even see the words L4 disc, L5, S1 on the images you have, and those are the areas that typically have the most stress. So again, we'll breeze through these. We've kind of went over this symptoms. It's a little bit different than just like muscle pain and soreness. You'll see more neurological symptoms, cramping, protective, spasms, but weakening, weakness, burning, aching, those are the big ones. What causes it? You can get a disc condition from a lot of different things, but car accidents are big ones, work injuries, sport injuries. I really see it can be immediate, like a fire or a pop in your back. That can be in your annulus tearing, which is part of the disc. I've also seen like things accumulate, like a stressful week. I ate something funny. My boss was driving me nuts. I didn't sleep really well. I went to go get a workout, or I went to garden all morning and then I felt a little tension. I went to bed and I couldn't get out of bed the next day. That's also kind of that slow burn that can create some stress into the disc. It gets inflamed and now we have an issue at that point. So one of the biggest issues we see is that a disc issue is often misdiagnosed as a soft tissue injury to the muscle or the ligaments of the spine. So I want to make sure to touch base on this. Basically, a muscle, a strain is where the muscles are pushed beyond their natural limits and tearing can occur. A sprain is if this occurs in a ligament to the spine. So if you're seeing a chiropractor or physical therapist and they're treating you for a lumbar sprain or strain, you should be getting some pretty positive results and feeling pretty good within a 6 to 8 week time frame at most. Those are pretty typical timelines for a soft tissue structure. But if you're not out of pain in that time, it's likely something else is involved in that. And like we said, it's highly probable you have a disc irritation or a disc condition. So now if there's radiating pain, which is down the arm or down the leg, or it could be local into the buttock or even into the groin, sometimes just down to the knee, this is usually stemming from a bulging, herniated, or degenerative disc. So anything over 8 weeks is generally, it starts to move into that chronic phase. And if it's not resolved by other forms of therapy, that things get tougher as it hangs around. So I really urge patients, don't let back pain, don't let the nerve symptoms hang around. Tissues can get sensitive, which means they get better at letting you know they're stressed out. And it often gets harder to treat as time goes on. So if you're not getting better with traditional therapies, the option is always surgery. But just to be very clear, this is a last case scenario. Only 1 to 3% of patients will need to undergo some types of therapy. That's good news, and you want to be in that rare category. So what's so effective? What's the difference at spinal decompression? I'll just start with at Tangelo, we specialize treating spinal related pain, chronic back pain and neck pain, disc herniations. That's our bread and butter. And the research says is that about 90% of people with spinal related pain will respond well to high level conservative management. Again, only 1 to 3, sometimes like depending on the study, we saw 10% earlier, of patients will need surgery. It's much lower than that. But it typically involves a healthy component of high level passive care, which is like, we're proud that at Tangelo, our clinical data mirrors that 90% success rate, but 90% is not 100%. There's always room for improvement. And there are just some patients that don't respond. And when they are not getting better and they're doing all the right stuff, we get frustrated, they get frustrated, and then we kind of run out of options. And typically we used to just refer out to a medical specialist. And then sometimes the patient doesn't even want that. So this is exactly why we researched and invested in spinal decompression therapy. And we're really thrilled. And our patients are excited about the results we're seeing. So what is spinal decompression therapy? It's been around since the 90s. We have a tremendous amount of supported research from major institutions. Harvard, Yale, Johns Hopkins have all researched this. So in terms of research, it's there. And that's important to us too, because we want to see that evidence. And the evidence is primarily based on a specific protocol. So that's a common misconception. People think decompression is just a special table, but essentially it's a program. But I'll start with a table. Essentially, you're lying on your back. You're strapped in, and there's a precise, gentle motorized distraction to decompress the area of focus. So I'm emphasizing the word precise because that is the major difference between decompression, or you might be thinking about traction. Traction has been around forever and essentially stretches the entire spine. Spinal decompression is very specific to the level we are trying to treat. So in other words, it's not going to stretch your whole spine. If you have a disc herniation at L4, L5, it's going to treat the L4, L5 disc. The other big difference between spinal decompression and traction is that spinal decompression is going to distract and release, and distract and release multiple times over the course and the treatment time period, which is typically around 30 to 40 minutes. So essentially that distraction and release, it's a pumping action, a pull and release. That is where the magic is happening with spinal decompression. That pull and then further pulling and release creates a negative pressure into the disc that allows the water to rehydrate back into the disc. And just to be clear, this is the only non-surgical approach that puts water back into the disc. The disc is made up of 85% water. And when we have a disc condition that's bulging, herniated, or degenerative, the disc has essentially lost its water content. So it doesn't have the fullness. It's like a flat tire, if you want to think about it that way. But what we're doing with decompression is creating a pumping effect that creates a vacuum that allows the disc to resorb that material. The protocol typically lasts 20 to 30 minutes, followed by ice. And we encourage specific supplements during the program to reduce inflammation and encourage healing in the spine. Here's a quick little video for you visual learners out there. Quick and easy. You'll feel a nice little distraction where you get that decompressing or that pumping effect that creates space within the disc itself. And that creates a negative pressure that allows highly rich new to resorb. So that's the magic of spinal decompression. And so now the question is, what else can put water back into the disc? The answer to that is nothing. Some discs will heal on their own. The body resorbs them. We don't know exactly why some do and some don't, but they do. It can take anywhere from 3 to 12 months. Physical therapy or other active activities, while it does strengthen the muscles around the spine, it's not going to put water back into the disc. Chiropractic is not going to put water back into the disc. Massage is not going to put water back in the disc, and surgery is not going to put water back in the disc. Surgery, instead, they're just going to go in and cut, they're going to go in and cut off the bulge. Sometimes they'll do a laminectomy where they open the part of the vertebral bone to relieve pressure off the nerves. And essentially this opens the hole and makes it larger. But we know, we have seen it. The disc can rehydrate, the disc can plump up, and that's coming non-surgically from spinal decompression. And when we see that, the bulge can recover. It can minimize, it can create more space. It can even resorb and take pressure off the nerve and or joint without surgery, which is essential. And when we have more space, there's less congestion, there's less inflammation. And this is when we get less pressure on the pain driving structures that cause symptoms. And when we have less pressure on the pain drivers, that's what we call resolution of symptoms. So people ask, and this is a great question, is spinal decompression safe? Yeah, this is an excellent question. And the answer is absolutely yes. It's cleared by the FDA. We at Tangelo, we use a Hill DT table. We've researched this. This was the highest quality, the best read, the best technology we found. Essentially, we strap you in and the computer does all the work. It reads your body, it adjusts its tension to maximize treatment and minimize any discomfort. So one, it's gentle and it feels good. And two, it's precise in its treatment, specifically treating the involved segment. So I'm going to keep hammering that point home. But people ask if they can get pulled apart and they split like a torture device. And I'm serious. I get it all the time. But it's worth noting that the table and its computer will actually cut out it with certain resistance, meaning if your body is fighting it, if it's not getting good therapy, it's actually going to stop. And then I'll be there. My techs will be there to help provide support and get you strapped into a more comfortable position. Patients report that it's often the first time they've been out of pain, and even the first time they've had a sense of relief in a very long time. Oftentimes they'll fall asleep on the table. But like I mentioned before, this is a tremendous amount of research by Harvard, Yale, and Johns Hopkins. Decompression therapy is an awesome way to treat the spine without surgery. It's not a chiropractic thing. It's a spine care thing. That's an important note. This was developed by medical doctors. You're going to see a lot more and more of this in the coming years at great spine clinics, not just chiropractic offices, because we're finding this is the best non-invasive way to effectively treat spine conditions when we're not responding to other types of care. Show me the results. I appreciate that. We have an excellent rate of recovery. And it's all about finding the right candidates for care. So if after an exam and reviewing imaging, it's determined you're a great candidate for spinal decompression, we can confidently say there's an 86% probability of a good or positive outcome. And we define a good or positive outcome as 50% less pain and 50% increased function. So those 8s and 10s out of pain are 3s and 4s. We get our life back when we can operate at a level like that. So we typically see more than 50%, but that's when we can, but that's what we can promise with the 86% certainty. And that's from all the research and our clinical outcomes mirror that percentage. And so we found amazing value in helping patients who do not or have not responded well to other conservative managements. Again, it's not just another stretch or exercise. This is a medical treatment. Determine if you're a good candidate for care. We have to do a history. We're going to take your history, and I want to hear your story. I want to hear what you've been through, what you responded well to, what you're hoping for. It's really important. What do you think's going on? Let's figure that out. And then we'll perform an examination, including specific orthopedic and neurological tests, screening for disc or screening for anything else that's going on. And we might order or review current imaging that you've had. And then the next step is to compile all the information and recommend the best treatment options for you. So if you're interested, or if you think you have a disc condition, or you maybe you've been suffering with some of the symptoms we've been talking about, and it's been past the 8 to 12 week time frame, let's take the next step and figure out what's going on. So the best thing is to call us and set up an evaluation for spinal decompression. If you haven't already, you can do it through online. You can do it through our phone numbers here. But our staff is awesome, and they'll get you scheduled. I hope to see you. So again, my name is Dr. Mike Smith. Thank you so much for taking the time to watch this video on disc conditions and hopefully figuring out how spinal decompression can help you when no other therapies have been able to help. But I wish you all the best, and I hope you take care.